Welcome to the TBI Innovator Series. I have here with me today Professor Michael Snyder. He's currently running a study to find out whether data collected from wearable devices can be used to predict the onset of infectious disease, such as COVID-19, before symptoms start. Mike, can you just start by telling us a bit about the work you're doing and how this can potentially be used by governments in the fight against COVID?
Yeah, so the project that we're focused on right now is really to try to do early detection of COVID, and it stems from our wearables work. What's special about smartwatches and other wearables is they're measuring you 24/7. So they literally make hundreds of thousands of measurements each day. And right now our window is 6 hours. We think we can tell when you're getting sick in about a 6-hour window in real time. It's all built on the individual. So you try and figure out people's baseline measurements, their resting heart rate. And then when they start going up from that in a statistically significant fashion, then we call a signal. We'll say, look, your heart rate's up more than it's ever been in the last 2 months. Something might be going on. Nearly every decision about your health is based on population-based averages. And the classic is this oral temperature. The party line is your oral temperature is 98.6. If your normal healthy temperature is 94.6 and you walk into a physician's office and they measure your temperature at 98.6, they tell you you're healthy, everything's fine. But you're at 4 degrees Fahrenheit over your background. I guarantee you are not healthy. You are ill if you're at 4 degrees Fahrenheit. The algorithm we're building is really dependent on heart rate, although we do want to bring in heart rate variability and other measurements as well. So we'll bring in as many measurements as we can. We know heart rate is a good one.
Can consumer wearables sort of begin to do all of this in the near future, do you think, to sort of an accurate degree?
Some of them aren't so accurate, like skin temperature and blood oxygen. Their absolute values aren't accurate. But it turns out that they can still pick up changes. So even if it's not quite getting your skin temperature quite right, when you get ill, it will shift.
I just sort of wonder how you think all these things sync together and what have been the barriers to getting them in place.
Doctors are scared of these devices because they are worried they'll turn them into hypochondriac. I think it's entirely the wrong way to look at it. Of course, I think it's these things can simply augment everything you're doing. And you teach people. People are eager to learn this stuff. There's nobody who pays to keep you healthy. The only way people get paid normally is when you're ill, but it would be much more cost beneficial if we actually kept people healthy. It is a cultural shift. You've got to get people thinking about preventative health. Let's work on keeping people healthy, again, and not react once they're ill.
If you can begin to design the systems that can do a lot more care remotely, you can actually quite dramatically change the delivery of care, which might mean, less visits to your doctors, less visits to hospitals.
It's like having a caregiver with you all the time, at least at some level, right? I think we're just at the starting point in all this. Unfortunately, sometimes it takes a wake-up call.
I think often one of the barriers to progress is that people sort of want it to be absolute.
There is no perfect medical test in anything. And in the case of the current pandemic and infectious disease, realistically, we have nothing. These are, they may be imperfect, but they'll give us some clues in a lot of cases. And that can be very, very helpful. No one can know your health like you can know your health. And then having devices and AI and things to help improve that, to help manage your health better, it's just totally logical. I think to go back on something you said, if you think about it, when you hit these situations where there's going to be a lot of unemployed people, a lot of people who won't have health care, it's a time to shake up the system. How do we do this right? Let's work on keeping people healthy while they're healthy. And I hope in the process we don't leave anyone behind. I hope we can do it to every person on the planet.